Hello, everyone. Welcome to The Wire. Welcome to The Wire. It's the 5th of October. Is anyone else very surprised how quickly this year is disappearing?
It's flying, isn't it?
Oh, I know.
Absolutely.
I know. Still time. We can fit a lot in. We are going to have to fit a lot in into the rest of this year. Do you know how many assessments we've got on the boil at the moment? We knew this would happen. Everybody's racing to the finish line. If they're not going in this next quarter, they're going in the first week of February. That's what the schedule's looking like. So my lovely colleague Kay is here. Wave, Kay. And we've got an awesome group of people here who are all in the various throes of preparing for accreditation. Whether they're preparing for their first cycle or second cycle, it's wonderful to have you here. And if you're watching the recording, it's wonderful that you've taken this time out to learn a little bit today about evaluation, impact measurement, all those sorts of ways that we might be able to know if we're doing an okay job or a fantastic job, right? So you want to know really where you sit, don't you? That's important for you and your community, but it's also important for the service excellence success, because there's about 23 references just to evaluation in those standards. So I'm going to take you through the big ones, the top ones today. I'm also going to give you a bit of a, I suppose, a little look at what evaluation is, because I think, you know, there's a lot of terms used there, which are all okay, by the way. And I'm going to give you a bit of a step-by-step process for evaluation too, if you're not quite sure where to start. But we always love to hear from you about what are you doing in this space, right? Because that's where the most value is. The most value is in hearing what people are doing. All right. So if you're willing to share today, that's going to really make it great for everyone. Speaking of sharing, why don't we now acknowledge the First Nations traditional custodians of the lands that we are on? And I will do that by renaming myself here. You can do it by popping into the chat, the First Nations custodians of the lands that you're on and the town or suburb maybe that you're joining us from. Marie at Highwire is on beautiful Biripi country, and I would like to acknowledge their elders, the keepers of knowledge, and I would like to acknowledge their deep connection to the land and waters here and appreciate their contribution to my learning, my cultural learning here. And I welcome you to do the same. Marie at Highwire is on Biripi country in beautiful Port Macquarie. Now, sometimes I have some friends from South Australia joining us, but they tend to rock along about half an hour late. So we'll see. We'll see what happens. We'll see what happens. Okie dokie. Thank you very much for those acknowledgements in the chat there. That's awesome. Kay is on the Gadigal land and Tamsin's on the Gadigal land as well. Beautiful. All right. Let's rock on. Let's rock on. There's some I've created some resources today, as always, for you. So there'll be some helpful things to support or, you know, to strengthen your already great systems around evaluation. I found some really groovy ones today from near and afar. Oh, ooh. Okay, let's have a look. Dee, dee, dee. There you go. To measure is to know. So true, isn't it? Oh, don't you wish we had more time for evaluation? Some really big questions that can be answered through your evaluation effort. Look at these. Like, talk to me. Let me know if you have found a way to know if your programs are having an impact. If you found a way to know if anybody is better off, like, how do you absolutely know? What's your evidence? To what extent are you meeting community need? How do you know? How do you know? Has anybody got a way that they're measuring this?
Here at Rural Outreach, we evaluate our Love Bites program that we deliver to school students.
Hmm.
We participated in the SHS client surveys.
Fantastic.
We're currently doing PWIs on individual clients.
That's great.
And thus far, all have had an improvement in their scores.
That is a really fabulous answer, Judith. That's exactly what we're looking for. Now, there'll be people in the room who are saying, yeah, we do that too. So it's very affirming. What else, Judith?
We've got a strategic plan in place with milestones and KPIs that we keep a regular eye on.
That's amazing. That's it, everyone. Workshop over. Thank you, Judith. That's awesome. I'm just joking. Judith, what a fabulous list. Now, if I was your assessor and you were telling me that that's how you measure and evaluate your impact, I would be giving you a big tick for that, right? That's excellent. Anyone else want to share the sorts of things that they're using? The PWI, if you're not sure, that's the Personal Wellbeing Index, which is loaded into Sims. It's a way of being able to measure people's improvement through the time with your service.
Yeah, that's on an individual basis.
Yeah.
Client to client.
That's right. Who else wants to share? How do you know that your programs are having an impact?
Yes, in All Care, we're, as you just said, we're an NDIS provider, amongst other things. NDIS has certain requirements that we have to, or targets we have to meet with individual participants. So we work with their stakeholders to develop a plan of action to take the participant from point A to point B, wherever that might be. Along the way, we have input from those stakeholders, that's their OTs, their therapists, their psychologists, and the people that we employ to work with them. We also do evaluations, and I've been employed as the Quality, Safety and Compliance Officer. So the quality part of my job is to develop and reinforce systems we have in place already to get feedback from our clients.
Yep.
They can call us at any time and complain or give us a Yahoo or anything like that. But my job is also to put in place or reinforce the things that are in place already, and we actually encourage our clients to send us written information, or their carers to say, okay, you're doing this good, or we could do with that, do that better. We ask them to give us feedback on the people that are working with them, so that we can make sure that we always provide a good fit of our staff with their needs. So there's a whole series of stuff like that. We're moving into other areas, and we're going to employ the same systems. They're not always people with disability, they're children in need, that sort of thing, but those systems will still work with them as long as we know what their goals and their ambitions are while they're with us under our care.
Terrific. Now, Robert has reminded me there that through the Service Excellence Framework, you are being asked to measure outcomes at the individual level and the community level. So it seems it's a little trickier at the community level, isn't it? I wonder if anybody agrees with me. Is it trickier to sort of measure your impact as a service in your community? Has anybody found a way to do that?
We've done an agency survey. We put it out to quite a lot of agencies to see how we were interacting and working with other agencies, but the problem that we struck was only 2 or 3 people filled it out and sent it back to us.
Yeah, I hear that a lot. Kay, what about you?
I was going to mention a couple of services I've worked with that
using some metrics around housing. So how long it takes for them to get people into housing, or how many people they're placing in medium-term or long-term housing. So that's kind of what, in a lot of cases, that's what they're setting out to do. So they're kind of tracking their progress. And an Aboriginal organisation I work with have got like some really, they probably sound like really small targets, but a lot of the families that come in, the kids don't have, like, they haven't got all of their, immunisations and birth certificates and all of those sort of normal things that kids need to enrol in school and that sort of thing. So, putting those up as things that they track and make sure that that all the kids that come through their service have got those things by the time they leave is another little evaluation tool they're using.
Oh, that's excellent. They're great examples, everyone. And remember, if you are a specialist homelessness service, which I know most of you here today are, not everyone who's watching is, but if you are a specialist homelessness service, you haven't yet been told all the things that you need to evaluate. You haven't had imposed an impact measurement framework. You nearly did. There was a pilot, and that pilot was in 2019, I think, and it was about to be rolled out, and then COVID came. So that would have said, right, these are all the things that you need to be keeping data on. This is the set of indicators or criterion that we need you to use to evaluate, the impact that you're having, not just outcomes, which is numbers generally, but the impact you're having. Who is better off and how much better off are they? That would be the impact measurement, yeah? So that hasn't been implemented. However, it is still there. That framework is there if anybody wanted to use it. And there was a pilot report done, which I can share a copy of that with you if anybody's interested. So, I just wanted to say there's room for you to decide the indicators, the criterion that you would like to measure in your community. And I think that that's fantastic, because every community is going to be different. And you can decide on the sorts of things that are challenges in your community and how you would like to measure your impact on that. Yeah. Somebody raised their hand. I think it was Tamsin.
Yeah. So we're actually quite lucky at WAGEC because I'm a dedicated evaluation person here.
Wonderful.
So, and evaluation and impact. And we have used the room to decide on the indicators that we're measuring, and impact as well for each of our programs. So impact on the particular cohorts that are affected by the programs.
Excellent.
It's interesting because when I first started here, I was trying to chase down those SHS indicators, and it was quite confusing really about why they were stalled and what was going on. So, so I've been able to go out to a lot of other services and sort of benchmark in terms of what they're using in terms of indicators, and use some of those ideas as well. And I'm still always looking. I would love to do more in terms of collaborating with other services on what we're measuring.
Well, what a wonderful attitude, Tamsin, from you and your organisation. And, at the risk of outing you, I do want to let everybody know that WAGEC have some very excellent, I'm going to use the fancy pants term, program logics, right? And really what I'm talking about is the theory of change, and as an organisation, I happen to know that they have thought about what is it that they want to deliver, how do they want to deliver it, what outcomes they're seeking, and how will they measure those outcomes. Now, that's a great framework to have, and many organisations do develop program logics around their service delivery effort, but not every organisation. And I wouldn't say you have to, but I would say it's probably best practice. Anything to add to that?
Yeah, it's one approach, theory
Mm.
of change approach to evaluation, as you know, and there are other approaches, but it's definitely sort of in terms of ease with programs and also the actual development of a theory of change is something you can do nicely with your program managers and service managers.
Mm.
And there's a logic to it, so it makes sense
Yeah.
to people.
Yeah.
So it's a really nice one-page way of describing a program. It's got a lot of benefits, that approach. Yeah.
Yeah. Yeah. And it's something you can look into as an organisation if you're interested in a sort of process-driven outcome or impact evaluation. Yeah. Champion, everyone. Champion. Some other questions that can be answered by evaluation here. These are great questions for organisations to know the answers to. Have a look. I like that one. How do cultural and diversity variations affect what is done and achieved? Oh, see, I do like that question. Because I think we're sometimes, one size fits all, aren't we, sometimes, in our approach to service delivery and particularly evaluations. So that's a really good one to try to measure, isn't it? And look at that second last one. I really like that one too, because I'm a big believer that today's solution is tomorrow's problem. There's evidence everywhere you look. You go on, you'll find it. What unintended consequences or negative side effects are appearing that need to be addressed. So sometimes we fix something or we put something in place, and unless we're really having a look at it, we might not be aware that it's having an unintended consequence somewhere else. Yeah, and in most cases, that's true. It will be. So there's some excellent questions there that you might get answered through your evaluation. But what is evaluation? Anybody want to have a guess? Type into the chat for me if you want to have a go at a definition for what is evaluation. Off you go. You can type some things into the chat. What are your thoughts on how would you nutshell it? Give me the shortest possible definition for evaluation that you could. Off we go. What are we going to get back here? Oh, Sonia, excellent. Assess effectiveness. That is great. 2 words. Nobody can beat Sonia on that. That's fantastic. Any other thoughts about what is evaluation? Yeah, assessment's often used in the context of evaluation. And in some contexts, people would see evaluation as being different to an assessment. Oh, yeah. I like to think evaluation, hear that word in there, value, right? So a value can be quite subjective, So, what I see as valuable or what I see as quality could be very different to what someone else would see as quality. What the organisation sees as quality would be very different to what a client would see as a quality service. You see that? So I think evaluation is looking for that, where's the value? Who finds this valuable or who finds this a quality service? Whereas assessment, I think, has a specific sort of criteria or standard, that sort of thing. But anyway, we're going to use these terms interchangeably. It's the measurement of progress towards set goals at every stage of the move forward. Robert, that's beautiful. At every stage of the move forward. I really love that about that little definition there, Robert. Thank you. Here's a simple one that I found. Systematic process. You see that? Because I love it that it says it's a systematic process. Right? It's not just one little effort over here with a bit of paper with some happy smiley faces on it. It is a systematic process to determine the merit, the worth, the value, the quality, or the significance of something. Yeah? Yeah. And it's used in decision making and planning. It becomes your evidence base for that move forward. All of these opportunities here for you, if you look at using a service excellence framework as an opportunity to strengthen your evaluation practice. All right, so there's lots of opportunities for you here to align improvements in your organisation as a whole moving forward, as well as meeting the criteria in the service excellence standards, right? So let's have a little look now at where the higher level evaluation appears in the framework, all right? So I'm just going to share my screen with you here. And what I'll pop into the resources this week is I have just highlighted throughout the evidence guide where you need to be mindful of your evaluation practice, all right? So if you want to be successful. Now, the first one we come up with here, and Kate, would love it if you'd add any exemplars here, or, you know, and if anybody's already doing this really well, please could you share with us? Just interrupt me, it's all right, you don't have to raise your hand. Look at this, the first one here under the planning standard is planning is informed by review processes. Now, we are looking for your strategic plan for as an example to be informed by performance data, right? Some evidence base that this is the reason we have set this strategic direction, right? It shouldn't just come out of, oh, wouldn't this be fun? Let's just do that because that'd be awesome. Oh, that's what they're doing over there. Let's do that. It really should be based on what you know about your organisation and what you know about your community. And that would require some evaluation of your performance data as an organisation, where your strengths, weaknesses, or your gaps are, where your strengths are, and what you know about your community. So some pretty detailed community profile. And I know most of you already do that. But we would definitely want to see how your strategic plan came into being. What sort of evidence did you use to develop it? All right, so that's the first one, where it appears. I'm sort of scanning through here.
Can I share something with you, Mary?
Go for it, Kate.
So I've been working with an organisation on their strategic plan, and we did a little survey that they sent out to other services in the area as a bit of a sanity check of perception of, you know, like where the current level of service to homelessness lies. So they, you know, they had part of it, but they wanted to check that their ideas matched with everyone else's. So they asked other organisations to assess not just them, but where does this community sit? Was it regional community? So they were asking them questions about what are the challenges, what are the, you know, what's happened lately, that sort of thing, as a bit of a means of like a bit more objectivity, I suppose, when they went into their planning day.
Perfect example. Perfect example. Inviting a range of perspectives. The next one here where I feel evaluation is relevant is where you identify opportunities for early intervention and prevention. And look at there, it says review of service models to identify alternatives. Now, you know, you might have an imposed service model under the Specialist Homelessness Service. However, you know, if you have any flexibility there, having a look at best practice, you know, both here and overseas, you might find, you know, some other service models or even evaluation frameworks that are going to be more suitable for you. We did an assessment this just recently with an organisation. They've implemented across their whole organisation this service model called the Sanctuary Model, and they based it on some really detailed research about whether this model would be suitable for them. And you know, it's implemented right from the governance level to the individual level, individual caseworker level. And it's got an evaluation built into it. So, you know, the Sanctuary Model, there's one. Scanning on down to, oh, there, sorry. This one says, progress against the business plan, including performance measures, is reviewed regularly. So we do want you evaluating or assessing your progress against achieving those targets or KPIs or measures of success that you've put into your plans. All right, so the organisation, here it is, can demonstrate that it measures and monitors its efficiency and effectiveness. So we will ask a question like, how do you know that you're progressing well in terms of your business plan or your strategic plan? And that's sometimes a really hard question for board members. That's a question that will go to a board or a CEO to answer. So that's that one. Moving on down. Monitoring and evaluation of the governing body are undertaken. All right, so the governing body needs to be able to say to itself, well, we know that we are doing a fantastic job of leading this organisation, and here's the evidence that tells us that. And here's where we benchmarked ourselves last year, and this is our improvement this year. And here's our action plan that we're putting in place to address those areas for development. In the resources that we're sharing with you, we have got a board evaluation survey that you can take and use if you like, or you can have us facilitate if you like. All right, so it doesn't have to be onerous. It can be a very simple sort of a process, but you need to do something to know that you are effective as a board or as a management committee, excuse me. Moving on down. Love it if you're sharing examples of anything that you're doing that's really, you know, good and helpful practice for other people to learn from. Here we go. Under 2.3, data and knowledge management. There are defined processes for the collection and analysis of information and data. So not only we're collecting it, but we're analysing it, and we're analysing it for the story that it's telling us. All right, so data, it's all there, but it's only useful if you are analysing it, if you're using it to see the trends, to see the story. So it's got there in the evidence guide, it's got there data can be used to monitor performance, right? So you are using data to monitor your performance. You're not just saying, oh, yeah, I think we're good. Yeah, we're pretty good. All right, we want you to know how good you are. We want you to be able to clearly show us as assessors as well.
I'll make a comment about data. This is a bit of a bugbear of mine. I find that a lot of organisations, well, are quite fixated on surveys. Like it's kind of like this is how we collect data, like particularly from our clients. And yeah, like my feeling is, you know, in the homelessness sector, it's very like it's very difficult to collect data, usable data from your clients. They tend to be very grateful for any help that you give them. So all they're going to tell you is you're wonderful, like which is very true. It just doesn't give you that much to work on if you actually want to do continuous improvement. And data that's collected from staff is completely valid and should be collected. So just because it's an observation and it hasn't come directly from a client doesn't mean it's not valid. So I encourage organisations to try and collect a lot more from the viewpoint of their staff, because they are often the client's voice. So, but collecting
that's an excellent observation. Yeah, that's an excellent observation. I think you should have with evaluation. I think you should have a 5-6 pronged approach. You know, I think that you should do what we do as assessors and you know, at least triangulate. You know, try to get your source of truth from 3 different places. You know, what is yeah, our surveys are telling us this, but what are our staff telling us, and what are those agencies that we work closely with telling us? And it's, yes, all kinds of formal and informal, structured and unstructured feedback, review, evaluation. It's all valid. It's all valid, you know, but if you're only doing one, if you have a heavy reliance, as Kate says, on surveys, And, you know, the only people filling in your surveys are those that are happy with your service. You're kind of missing a few perspectives there. Yes, Tamsin.
I agree heavily with triangulation. One thing we've started doing recently at WageEck is talk to kids directly, using a model that was developed by the Australian Childhood Foundation. And that's really interesting because then you can get data from staff ops, from parents, and from kids directly. So you really do get a rich picture of what's going on for that child or those children.
Absolutely.
It's
Absolutely.
satisfying.
Yeah, if you really want it, if you really want feedback, you will get it. And we meet a lot of organisations. Kay will throw her hands in the air like a, you know, like a what are these called? The jazzy hands, happy
Jazz
hands. How many organisations, Kay, have we heard that say, "Oh, we don't get any complaints"?
Oh,
Right? Yeah, that many, right?
loads.
We don't get any complaints. Again, if I'm saying, if you want complaints, if you want to hear what people really, 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 really think, then you will get it. You'll find a way to get it. A youth refuge that we recently visited, they have now just put QR codes all around the refuge because they know all their young people have phones, and the young people, whatever they're thinking or feeling in the moment, and they want to say something about it, they can just click onto that QR code and give feedback. Yeah, and it's anonymous. And so, yeah, and that's really in their, they've only been in their first week of their trial, but it's working really well. And they get some really funny comments, of course, but they're getting a lot of feedback. Yes. So there you go.
Yeah,
Sometimes too. Oh, sorry. Should I?
I was just gonna add that we had a funny experience where we were trying to go through this interview process with young people at one of our refuges, and the teenagers kept running away because they didn't want to be part of it. So we worked out that what we needed to do was to send a survey to their phones, and they did it and got the most beautiful, honest feedback. So yeah, it's just really moving to have that happen.
Well, we're sorry, Kay, I'll get you in. We are a third party assessor, evaluator, if you like. And when we contact clients and when we contact young people as part of the accreditation process, you know, that they are articulate, they are, you know, able to answer all the questions. They are so very proud that they get the opportunity to say what they think about the service. Oftentimes they've been able to tell us the things they really hate, they wish would stop, you know, they should have more of this, they should really paint this place. Like, you know, they will tell, if they feel safe in that process, they will tell you. And so, I mean, you know, you pay a lot for us as assessors to come in and ask those questions, but maybe you could have some people on your team ring up who are not working directly with those clients, but who would ring and empower them to give that feedback occasionally. Yeah. Kay?
Oh, I wanted to say that often evaluation's a bit of an afterthought. Like I'll quickly better, you know, do a survey or ask people or something like that. But it's actually a real process that you need to go through. And sometimes, you know, what you'll do is start with really informal stuff that seems like, you know, it's not coalescing into anything. And you keep working on it, like just keep gathering more and more information, and that might eventually get you down to some real indicators that you can go, look, you know, there's a common theme here. Everyone's saying, you know, saying something, and that's what we can survey. So instead of trying to work out what the survey looks like, you can mush all your information together for a while and then do a targeted survey or phone questions or whatever it is, without sort of bombarding people with a million questions. You might just target a little bit and go, this is what we're going to aim for this year or something, is finding this bit. So having a plan around that, which I'm sure is what Tamsin's life's all about. But
But we can
Bob, I
work
can hear you
on-
there.
If the area we work in, we're not short on complaints and feedback.
Ah,
No, seriously, the reason is that it's a highly emotional
yeah,
situations that we're dealing with because of
Yeah.
people with a disability and their carers. The problem we sometimes have is sorting out the wheat from the chaff.
sure.
But eventually, over a period of time, dealing with each of the participants,
Yeah,
we learn to work out what part of the complaint is genuine and what is not.
yeah, yeah,
But having said that,
yeah,
we can still do better because we need to actually sit down, and that's going to be part of my job to go through those complaints and feedback and look at trends in to see whether our service is doing the right thing or whether a particular worker is doing the right thing.
yeah,
We have a lot of supported and independent living residences, so we need to look at the comments and determine whether the conditions in those residences are okay for the people there, whether they're feeling at home or just not. That's a whole lot of stuff we've got to analyse to make sure we keep moving forward.
Well, Bob, I just think what a different situation you'd be in if you didn't have all of that data there in front of you in order to see a trend. You know, you're flying blind, I think, if you don't, you know, the more you have, the more sort of sound knowledge you have about the trends, you know, the things that are coming your way, the things that could become really awful kinds of incidents, really adverse events, you know. I often say, you know, you'll be able to see from those trends whether you're cruising for a bruising, you know, like just you'll see what's coming. The story will be there. But not if you don't have enough data to analyse a trend, to see a trend.
Yeah.
And if you're not able to get a visual on it over time, you know, some people have a system where they've got their complaints and feedback in a folder on the shelf. And I'll say, yeah, but how can you see the trend? You can't see it. So the tool for measurement is just as important, really, I think, as the measurement itself, you know, that you're able to actually see the story quite easily. So thank you, Bob, for that comment. This one here is about analysing your incidents, accidents, and near misses, exactly what we're talking about, right? Looking for the trends. And so, you know, evaluating what that data there is telling you.
Can I tell you a funny story about that? We're running out of time.
Oh, there's always time for a funny story, Kay.
So this is about different people reporting things. So yeah, had an organisation going, yeah, we don't get patterns in things, you know, stuff just happens, you know.
Random.
But, yeah, just random. It's just random. And then, like, I swear 5 minutes later, they were telling me about 3 different people that had jammed their fingers in the same door. That sounds like a pattern to me.
Exactly. That is a pattern.
And they went, oh, yeah, you know, but, you know, different people at different times, they'd done their incident reports, filed them, didn't think about it again.
Yeah.
Just went, oh, maybe you should put a door closer on that door. And they went, oh, yeah, we could do that.
Exactly.
So, yeah, it's a real trap when you've got multiple people reporting stuff on incidents. So you could think you're the only one and there's 10 other people that have done it.
Yeah, that's why you need the tool that enables you to see the reporting. You need the sort of the columns that you can easily sort and you can start to see those trends. All right. So sometimes we do give some recommendations about that. You know, ways to improve that sort of visualization of the data. Yeah. Performance review here. This is, I suppose, an evaluation that you'd be doing on your team members. All right, so you would be doing an evaluation against the objectives of their role, you know, how they're supporting your organisational values, those behaviours in the code of conduct, those sorts of things there. And it is important that you're doing that review against a set of agreed criteria. Yeah, so that is definitely a form of important evaluation in an organisation that we look for. Scanning down. Nearly there, nearly there. Now, this one here, this new standard under the well, it's not a new standard, the Healthy Workplace Standard, but it's been developed to have 4 criteria. And one of the criteria under it is, look at this one, monitoring and evaluation on the performance and effectiveness of your health and wellbeing activities. Now, a lot of people are getting a gap in this space at the moment because there is a focus on a healthy workplace, health and wellbeing in the workplace. And it does require that you not only be having, promoting healthy choices and having health activities, health and wellbeing activities, but that you are evaluating them. And so this might be done through a staff survey, so you might start to add health and wellbeing to your existing staff survey and asking, it could be something that you add to your supervision framework, your reflective practice framework. All right, so your exit interview, if you do have that with staff, yeah. So it doesn't have to be, big and formal and structured, but you do need some way of monitoring and evaluating that your health and wellbeing activities are having an impact. See, there's quite a lot on that one. There is one here under the diversity and inclusion standard where you shall be measuring your performance regarding support for and promotion of diversity, inclusion, cultural safety and capability. So you need to be measuring how well you're doing there. And it probably won't be enough to just be able to cite some Aboriginal, non-Aboriginal data from SIMS. So we'd like you to be looking at a range of diversity characteristics there. And we'd like you to be sort of having a benchmark and then measuring it and then maybe seeing some targets and things like that. If you have a RAP, for example, you've probably got some sort of stretch targets in there, or if you have set some targets in your workforce planning around having a more diverse workforce, then, that's the sort of thing we'd be looking for.
Marie, is
Yeah.
that one just in relation to staff or clients as well?
Staff and clients.
Staff and clients, yeah.
Yeah, it's under the people one, but it's under the people standard, isn't it? But
Yeah. It is under the people standard, but
and it's got applications for clients.
Yeah, it means all the people that you work with, staff, volunteers, even contractors, clients.
It comes up again in Section 8 anyway.
This sort of one here on the screen is about your partnerships and whether or not they are regularly reviewed. And I suppose what they're being reviewed for is impact. So you might have a range of partnerships with organisations, and the reason you'd be reviewing them is to see, well, are we meeting our objectives? Are we having the impact we intended with this partnership? Or could we be getting more impact with a different partner? Strategic. Now, there's a couple more down in number 7 that I'll just flick down there. There's one in communication, which is about evaluating the effectiveness of your communication to receive feedback, etc. That one there. Regularly evaluating your communication processes. But down here, we've actually got like organisational evaluation and monitoring. So plan service outcomes align with your strategic direction, but that here outcome measurement tools are used. Outcome measurement tools are used to measure population performance outcomes at individual program and organisational levels. So for your larger organisations, I might just go to Danella here because I know that you've had, I know that you've been really committed to implementing an outcome measurement tool here and there, and I just wonder where you've landed on this.
So the results-based accountability was something that we invested in for quite some time. But due to, I guess, the various different platforms that required us to provide data, back to the funding bodies, the management team found it overwhelming. And staff, there was just too many, too many things that they had to commit to. So I personally think the results-based accountability is a fantastic tool. I really, because it does tell us about whether, people are better off, the change in the circumstances, how much we're putting into it, and yes, some of the programs have done their program logic and done a terrific job at doing those. So they're sort of a really good tool for us to use as well. So I don't know whether we've settled on anything in particular, but certainly program logic is the way that we're working through at the moment. I think that, those elements of the results-based accountability is something that we should really revisit. So, yeah.
We'll take a little sneak peek at that in a moment. Yeah, I like it. Many organisations that we know are using it, but particularly in South Australia because that's where it was born as a framework. Yeah, so that's why it's got a lot of traction there. Thanks, Danella. Know that sometimes when you get overwhelmed as an organisation, you kind of retreat to what you must do. Instead of all the things you would really like to do, when it's limited resources, you've got to go back to compliance, don't you?
Yeah. And I think the only thing that, I wanted to add there is really that the fact that when we're providing data to the funding bodies and those types of things, it's around providing the data that they want to capture. And it's not specifically the targets or the goals that we're wanting to establish for ourselves. So I think that's the important thing, is to identify those and to find a tool that works.
Exactly. Good. That's excellent messaging, actually. Yeah. And while there's a little kind of, there's no must do in this space, be creative and innovative about the way that you would like to measure some things. What's important for you to measure? This one here, outcome performance is monitored with the information used to improve efficiency and effectiveness of your service. Really, that's where it's at. You've got some way of knowing how well you are doing so that you have an evidence base for improvement. All right, so I wouldn't be coming to your team with change and improvement and let's do this unless you've got a really good evidence base for it. I'm talking to all of you quality champions out there. I think I'm going to leave that there, but there's only a couple more. Anyway.
Is it okay to say to Marie, baby steps, like particularly for those really small organisations, that evidence guide can be a bit terrifying if you've got 5 employees to look at that and go, oh, we're going to do results-based accountability. Like, it's just, I think, people, like, it has to be scaled down. Like, yes, you should be looking for something, but the expectation of a very small organisation is not right up there with, an organisation with 100 employees. So, yeah.
No, one of the really good examples that I've seen, and I've seen this duplicated across many organisations, is every year they do a staff survey. They just, from year to year, they have some base questions and then they have some, we really want to know more about these kind of questions, right? Every year. So they've got a baseline and they can see their improvement and they can develop action plan from there. They have, every year they do a, what do they call it there? Community focus group. They have a focus group of the current clients, past clients, some community partners that they work really closely together with. They give them a lunch, they invite them, they ask them maybe 10 questions at the lunch, and every year they measure that improvement. And they also do 3. I can't remember the other one. Staff survey. The community network survey.
Partners or stakeholders?
I don't think they do a partner one. Oh, I know they do a board evaluation one, but anyway, there you go. I mean, and they've got 3 there, just ways that they want to measure you know, how they're going.
Yeah, thank
What?
you, because I was a little bit freaking out just now, thinking, oh my
Looking
God.
at your face, Steph.
Yeah.
No.
That was really helpful. But we do all this next lot of stuff that you spoke about, Marie. We run the focus groups. We have the planning days. We've got a theory of change day coming up. So I was like, okay, cool. We're all right.
That's why we're here, right? So
Yeah.
nothing to worry about, anyone.
Yeah.
All right. So this is not like compliance around police checks, right? This is really about you and the context of you. All right.
Yeah.
But you
Well,
need to be.
spreadsheets are good at the moment with our graphs, right? Like,
Wow, you've even got graphs. See, we're visual people, Kay and I. We love that.
yeah.
All right. So evaluation has different labels. If you're doing any of these things here, you are in the frame of evaluation when it comes to service excellence. All right. So whatever you're calling it, it's all good. And this is a PowerPoint resource that I'm going to leave with you. I won't go through this, but different types of evaluation that if you're really into this, you might consider. I like this one here, the evaluation for different purposes, right? So formative evaluation is that kind of evaluation that you do to sort of see how your systems are working and to tweak and make improvements. And then summative evaluation is to inform decisions. So you might go, right, what do we know? We know all of this here. Are we going to start doing something? Are we going to continue doing something? Are we going to expand this program? Or are we going to stop this program? You see that? So different types of evaluation, different purposes for evaluation. So good to sort of understand that a little bit. You can get evaluations done by different groups. Kay and I always think it's great to develop a team of people internally who can be doing some of the monitoring, who can be doing some of the evaluating, doing some of the internal auditing, some of the checking. All right. It's really fabulous professional development. And it really does help people to see the quality system as a whole. All right. So, you know, involve lots of people in your evaluations. Now, I've got a nice, simple 4-step process here for you if you're thinking of checking your evaluation practice against this one, right? So, firstly, define the parameters of the evaluation. What's in, what's out, what do you want to measure? All right, and there's a few little questions there that you might consider as part of that step. Now, I want to say that the parameters of the evaluation should be way at the beginning. You always start with the end in mind. So if you start developing an evaluation process after you've implemented a program, you're going to find it's very hard to maybe measure the sorts of things that you want to, because you won't have collected the data as you've gone. Do you know what I mean? You might think, oh, why didn't we collect data about that? We really want to know about that. So evaluation parameters need to be determined way at the beginning of the implementation of a program or a project. So if you're sitting down, we've got a new program, we've got a new project, let the first question out of everybody's mouth be, how are we going to measure our success here? Set that up right from the beginning. Then design the methods that you'll use for the evaluation, the methods and the tools that you're going to use, how are you going to, where you're going to put the data when it's collected, how would that be a visual, sort of easy to see sort of tool for you to use. And remember triangulation, what a fancy word, but it means let's collect evidence that we are great in 3 different ways, 3 different perspectives maybe, or 3 different methods maybe. And then set the standards and collect the evidence. So you've got to decide on the scales to be used to determine quality, right? Quality meaning like, are we any good? You have to determine the scale. So you might you be thinking about, the questions that we're going to be asking. And what's the decision-making process? Like if we get this far, are we going to go ahead with it? If we find this, are we going to stop that? If we find this, will we still expand? You know, so you're going to have to set up the decision-making framework there. Go ahead, collect the evidence and document the findings, right? That when I say document the findings, I mean, this is probably important to have a way of documenting the findings so it's going to be easy for you to find the story in there. I know this from myself when I'm documenting findings. Sometimes I take too much information in and then it's very, very hard for me to interpret. It's very hard for me to find the story in there. All right, so I've got to sort of set up that sort of structure and stuff first. And then report and make decisions. So, I made a little mistake there. Don't worry about that. Report the information, implement the decisions, document the results. Document it. People will say, yeah, we evaluated that program. Where's that documented? Okay, so make sure that that's something that's accessible to all the people in your organisation are going to want to know those key learnings. So many organisations have probably got information in them that could save other people a lot of time and effort in the future if we had a way of creating that learning bank. And who are the appropriate stakeholders that you want to report all your findings to? That is another of the indicators in the standards, is that your achievements are reported to your stakeholders. So it's worth thinking about that in this process as well. Here you go. From your, I will admit Lana, even though she's here at the end, how sad for Lana. The outcomes-based commissioning pilot that was done in the SHS program here. You do have here the Personal Wellbeing Index in SIMS. You do have the Client Outcome Survey available to you. So, there's a couple of indicators there that you can use. Measuring community impact. Now, I just happen to know about these two that do come out of Department of Human Services in South Australia, the same home as the Service Excellence Standards. And the results-based accountability, there's some information there. That's a link you can click on if you want to know more about that framework. I might click on, no, I won't click on that now. I'll leave you to do that. And the social impact framework as well, both measuring at the community level, but the results-based accountability can be used at the individual level as well. It's probably why we like it. All right, so that's a key question for you to remember. There's some other On the Wire sessions related to this topic that you might want to take a sneak peek at, because we have been alluding to the internal auditing, that system monitoring, so evaluating the effectiveness of your systems internally. So have a look at the internal auditing session that we did. And specifically, if you're interested in monitoring and evaluation of the governing body, that's session 22. Okay. And as promised, the next session will be about partnerships of purpose. And after that, ending the year with professional development and supervision. The end of another On the Wire. Questions, comments? We've gone 4 minutes over, but that's all right. We've done well. Everybody's contributed today. Thank you so much. Lana, are you here? No, she was so embarrassed she had to jump out. Look at that. Poor Lana. My South Australian friend. I know. Don't say anything about South Australia. I wouldn't dare. All right. I'm going to stop recording now and thank everybody for their participation today. I'll just stop recording and you can hang around. Bye-bye.